filled with insights, experiences, and meaningful dialogues as we explore ways to elevate nursing quality and safe practice. We begin today's session with a foundational topic that shapes how we understand and elevate nursing care, and that is nursing sensitive quality indicators, NSQIs as we call it. Leading this important discussion is Ms. Nitu K.S., Deputy General Manager, Nursing Operations at Yashoda Hospital, High-Tech City, Hyderabad. Nitu brings a compelling combination of clinical depth and data-driven insights. She holds a master's degree in nursing and an MBA in healthcare management and is certified in Lean Six Sigma Black Belt, Hospital Infection Control, and Microsoft Power BI. She is an active member of professional associations, is a regular speaker at nursing forums, and a recipient of multiple awards, including the Rising Star Award from Max Healthcare. Her broad expertise allows her to bridge the gap between frontline nursing practice and strategic quality outcomes. Please join me in warmly welcoming Ms. Nitu K.S. as she guides us to this very critical topic. Over to you, Nitu.
Thank you so much, ma'am. My sincere thanks to for this opportunity and honor in speaking for the joint forum of CAHO, NE, and INS. It was my privilege that I bring my knowledge and expertise and also grab today some of the great experiences held over in healthcare with the other members. And I'm grateful for the warm welcome, enriching discussions, and this chance to contribute my topic, the identification of nursing sensitive quality indicators. As we all know that nursing quality indicators is basically what is the first thing what usually comes in our mind. So before that, I just wanted to tell about the today's discussion, which we're going to have is about the introduction of NSQIs, the importance of it, categories and different data collection and reporting, how we go further, and application of quality improvement initiatives, and how the role of nursing leader can improve the nursing practices with the help of nursing sensitive quality indicators. So before I move further, I just wanted my participants, please scan this code, and first thing, what is the first word comes in your mind when you hear the word nursing sensitive quality indicators? I'm just waiting for your response. You can scan this QR code and you can put up whatever the word comes into your mind. Just scan the QR code and you can write down and submit the words which is coming in your mind. I hope the screen is visible and you're able to do it. Dedication, okay. You can see the participants are typing. You just need to scan this QR code and you can type the first word coming in your mind when you hear nursing sensitive quality indicator. Okay, patient safety, right? Parameter that ensures to elevate nursing care, standardization, NABH, JCI, nursing care, ensuring to below the benchmark, accreditations, KPIs, improvement. Okay. Anything new, accreditation improvements. Maximum people are talking about patient safety. Great. Evidence-based practices, ensuring the benchmarks. Okay. Still, we have a maximum on patient safety. Care with quality. Okay. Quality care, competency. Push. Okay. I think somebody is talking about the push tool or pushing the nursing people to the better care. Okay. So when we see that almost the things coming all around is patient safety, of course, the nursing sensitive quality indicators, when we talk about quality indicator, it actually enhances the services. So moving forward with these answers, as American Nursing Association in 1996, they have given the brief about what they mean by nursing sensitive quality indicators. Basically, it reflects the structure, the process and outcomes of nursing care. how we have like indicators which focus on the patient care and directly affect the nursing practices. So here, the Anna has been thinking about that how the nursing services impact the patient care majorly. That helps to track the nursing care influences. Like basically, our nursing care directly influence on the clinical outcome, patient safety, and satisfaction. The focus area under nursing care nurses is directly controlled by the influencing, such as preventing falls, infections, and pressure injuries. The importance of nursing sensitive quality indicator. Basically, it promotes accountability and transparency in nursing care. How you get accountable about it. When you know that it has been monitored, it has been checked, you become more sensitive about providing a care. Drives the quality improvement and evidence-based practices. The quality improvement initiatives helps us to give a better clinical outcome, give a better nursing care, and as well as give a quality care. The evidence-based practices which help us to understand what is best for our patient to improve. That's how basically we usually implement it. And the nursing sensitive quality indicators basically help us to go along with the best evidence-based practices. It enhances the patient safety and clinical outcomes. Of course, with the help of, if we are improving in our quality indicators, the benchmarks are in set, and when we are able to reduce as per our benchmarks, it actually gives a better outcomes, clinical outcomes in coming to the preventing the infections, preventing the harm to the patients. It will help. Support data driven decision making. To the leaders, it helps how to decide upon data, which areas we require the more improvement, which area is a strength, which area is a weakness, we able to help and be able to understand it. Drives resources optimization. It helps what is the requirement of the time. For example, if it is comes to a pressure injury, what is basically we require? If it is that is my pain area where I have to work on optimizing my requirement for that particular indicator. It's also assist in benchmarking and identifying the best practices. Benchmark is basically where you're putting a threshold that your indicators should not go beyond this. You have to control under that. That will help you to understand that where the areas we need to focus, where the improvement plan has to be initiated and enhance the care for better outcome. Identifying the best practices. This also helps to understand and implement the best practices across the unit. Coming to the following, again, I'm putting a question to the participants that which of the following do you think these are the nurses are most responsible for tracking in terms of quality? Which all these indicators you feel that the nurses has to track and they are most responsible for such errors? Can I get the answers? Yeah, all of the above. Medication error. Okay, all of the above. It's getting increased. Right. So somewhere we all know that nurses are responsible for every kind of harms which is happening in the patient, whether it is related to a skin injury, whether it is related to a medication, whether it is related to a patient fall. Now we will go one by one. What is this nursing sensitive indicators comes across? It is basically all of the above we are responsible for. So now we understand the categories of nursing sensitive quality indicator. As we know that the quality indicators are also is like audits. It is defined against the structure, the process, and the outcome based. So as we understood in the definition, it is defined by Anna. The structure indicator is basically helps to understand the organization and resource related attributes. So specifically how your resource and how your infrastructure is working towards the patient safety, how your manpower you're supposed to plan. The majorly it focus upon the nursing workforce capacity, their education and infrastructure, because as per the requirement of the patient need in particular area, we need such kind of a nurses. And nowadays we know that we are almost getting 70 to 60% of nurses, 60 to 70% of nurses are freshers. So there we have to put up the training, where we require to put up the training. Indicators will help us to understand that. Reflects the readiness to provide care and not the care itself. So what are the structure indicators you think that basically can be a structure indicator? Like which nursing quality indicators you will count in structure, where you will focus on your resources, where you focus on your infrastructure, your education, trainings, what all the indicators you think that it is a structure indicators? Can I get some answers from the participants? What things comes in your mind? I just wanted to understand where we come about. Yeah, attrition rate, nurse-patient ratio, very correct. Anything else as a structure indicator when it comes to nursing? Nurse-patient ratio, TAT. Okay, education and continued training program. Anything comes upon on the basis of nursing utilization? Anybody thinks that the structure indicator can be? Qualification and experience. How we gonna measure it? Nursing initial assessments, training, hand hygiene bundles. Education patient ratio, okay, nurse ratio, nurse utilization. So maximum participants are saying NP ratio, that is nurse patient ratio, is one of the structure indicator. Very right. Okay. NP ratio. Okay. So moving with that answers, yes. So nurse to patient ratio is one of the structure indicators which we need to, which help us to understand that how much acuity of a patient is required, what competent nurse. Total nursing care hours per patient day. Basically, it is allow you to understand the acuity of your patient, and on this basis, you can assign the particular competent nurse. The levels of nurse, percentage of your registered nurse with specialty certification, that also help you to give a support to the clinical nurses of having a better outcome. Or also there are specialized courses happens which helps to enhance the services. Skill mix of registered nurse, your LPNs, nursing assistants, nurse turnover rates, it helps to understand what kind of a resources can be mixed up, because we all know that the NP ratio is not alone the nurses we are maintaining nowadays. We are not get enough numbers as per the occupancy. It changes, it varies. There it helps to do add on a skill mix of different kind of a nurses which assist you in serving the process. Registered nurse vacancy rate, availability of clinical resources, number of nursing staff with advanced degrees. So these all things is comes under our structure category as a structure indicator. Next is process-based process indicators, which specifically focuses upon the practices which we are rendering at the bedside. So specific nursing activities, assessments, and intervention. It focuses on what nurse do. So basically, a nurse assess the requirement of patient. We set a goal, then we put up our plans, we do implementation, and expect a evaluation on the basis of outcome which we have standardized in our goals. The evidence-based practice nursing standards also we can develop through the process indicators, and directly it actually influence the patient outcomes. So few examples for these particular indicators are timeliness of nursing assessment. So our initial assessments, there are defined time period usually we have in the policies that it should be completed in for example, in emergency, some of the hospitals says is within 5 minutes or 15 minutes. In ICU, it will be 30 or 2 hours, and in wards, it is different. So on the basis of that, nursing initial assessment actually give you outline of the patient. So it is important to understand it within the time. Adherence to the pain assessment, compliance with the medication administration rights. So majority of the indicator you can see, these are focusing upon the practices and activities which we are performing on a patient. Documentation of patient education provided, use of care bundles. So usually our ICNs used to do this, check that the care bundle has been properly been implemented on patient or not. Monitoring on and documentation of restrained use. So these are the process indicators which help us to understand the nursing activities and where we have to implement the education and the training and the treatment to improve and enhance the practices. Coming to the outcome, which is everyone's choice, is that it should be a positive outcome always. So for that measurements, we supposed to have an outcome indicators where we are focusing on the clinical outcomes, the patient outcome supposed to be a better one. So measures that results or impacts on the nursing care, reflects the effectiveness and the quality of our care. It also helps to evaluate that the patient is safe and recovered and satisfied from us, and often used for benchmarking and quality improvement projects. So these are the indicators most commonly which we are implementing at the bedside is hospital acquired pressure injuries, patient fall, HAIs, IV infiltration and phlebitis rates. So all these are the outcome based indicators which help us to enhance the practices to have a better outcome in the patient related to the patient injuries or the patient complications which is happening due to our practices. Patient satisfaction with nursing care, incidence of medication error or near misses or unplanned extubation. These are the few examples which I have listed down. There are further more, which is basically the outcome indicators for nursing. So how we supposed to do the data collection? How the nursing sensitive indicators can be collected and reported? So there are different methods. We all know that there is use of incident reports. There are audits. During audits also we identify the errors in the EMR feedback from the patient or other stakeholders like doctors usually help us to understand where the practice needed to be improved or any process which deviated from the there is a deviation in the processes and leads to an error. So these are the method where we can do the data collection and reporting. Regular review of our quality team and nursing committees. Benchmarking with NSQI, that is National Database Nursing Quality Indicator, which have the several nursing quality indicator benchmarks available at the world level and national level, and National Health Safety Networks and National Health Safety Research Center as well, National Health System Research Center. So these are the particular uh, uh, system where we can have the best benchmarking. Transparent dashboard tracking. So dashboard is basically I think every leader should have the dashboards of nursing quality indicator, including the indicator which reflects the nursing practices as well as nursing resources, with that education and training, which helps us to understand where the care is, where we need improvement, where the things are running fine. So this will help to do a proper reporting and collection of the data. Then application in quality improvement of the indicators. So and then NSQI is basically guide us to do a proper root cause analysis, because whenever the incident has been reported, if you do a proper root cause analysis, we'll come to know where is there is a lacking. It is never be a person based issues. It always be major comes as system based errors, where we need to strengthen our processes and the system, because I think we should not depend on the person. We should always focus on the processes. The processes should be so strong that everybody should work on accordingly. So NSQI is basically guide us to have a better analysis, and we can further improve our processes. Helps to set the targets. So difference between a benchmark and target is basically we always try to reach to the target or beyond the target we should go, but in benchmarking it is a threshold, we should be always below the benchmark. So that is the difference. So here this also help us to set our targets and KPIs for the nurses. So it is not which is defined in NABH books or somewhere. We can define our own key performance indicator on the basis of the services which we are having and where the concerns are coming up. Because with the help of severity index, you can define the problems, and we can work upon it as per the requirement. It also supports staff training, because it will give you where are the trainings are lacking, where are we need an improvement, and also it helps to do the policy updation. It drives continuous monitoring and improvement, because I think to sustain any practice, we need to monitor it continuously. Wherever where have to improve, the things need to be implemented, things need to be improvised, so that the enhancement in the care can be happen, and also it will also help to strengthen the nursing power to render the better care in the clinicals, as well as it also give a confidence to the nurses to go along with the better knowledge. So drives a continuous monitoring and improvement further. This will help. Then what will be a role of a nursing leader? Being a nursing leader, what the nursing sensitive indicators help us to, it helps to promote culture of safety and accountability. So by encouraging incident reporting and quality focused practices, we actually makes our nurses to be more accountable about it, and more safe culture for the patient as well as for the employees and the staffs working around. Monitor and analyze the NSQI's data. It helps to understand what is the trend is going, where the I need a goal to be set up, and where there is a need of clinical improvement. It also educates my nurses and empowers them to have a best practice and accurate documentation, because I think documentation is one of the important factor which help us to that what is exactly we supposed to be doing on the patient, what is we have done on the patient should be documented, and what we are documenting should happen on the patient. It should not be a incorrect documentation. For example, within my experiences, I do understand sometimes it happens the documentations nowadays, like we are not checking the vitals and we are documenting. So these indicators, when we know that there is some errors and issues are coming up in our picture, we can set up such indicators to have a better monitoring. So it will make nurses to be accurate with whatever they are documenting. Lead or support the quality improvement initiatives, protocols to be developed, and compliance with the care standards. So it helps us to give a care pathway for the nurse. So it is easy to understand her that when the patient comes, what I supposed to do. For example, if I am developing a care pathway for fall, so when my patient, adult patient, is entering to the system, where the patient initial assessment done as per the age criteria, which particular scale she's supposed to use, if the patient coming in which category, all these things can be easily defined, and we can give a flow to a nurse who's working at bedside. So there is no always need any kind of a training and retraining. That pathway, it will itself will help a nurse to understand the patient care. It also advocates for the necessary resources where it comes to staffing, where it comes to training and the tools to enhance the care delivery. So basically, the nursing quality indicators data help to understand the system whole and work towards a better care. So with that, I just conclude my topic of nursing sensitive quality indicators are essential tools that help to measure the impact of nursing care on patient outcome, safety, and satisfaction. By actively engaging with NSQIs, nurses and leaders can drive up continuous quality improvements and deliver safer and evidence-based practices. So it will actually give you a clear picture. And resting my words with saying this thing that you can't improve what you don't measure. So it is really necessary that we have to check on quantitative way, and then only we can provide a qualitative care. Thank you so much.